Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. And we are taking your calls at 866-870-5752.
I'm going to repeat that for you. Write it down. If you call in, you're going to get a free copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it's a 200-page book. It's got 256 scientific studies in it on how stem cells and platelets help heal the body. And when I say heal, I'm talking about we only do orthopedics with these things, although we're doing sexual health where we can inject platelets into the penis for erection dysfunction, and we're doing PRP on the face for what's called the vampire facelift. So the book has also has a chapter on hair regrowth using PRP and stem cells, and a chapter on the vampire facelift. I have another book that is coming out on sexual health, which I think most people need assistance in as they get older. They just don't like to talk about it. So you're free to call me anytime and talk to me about it. And the number to the studio is 866-870-5752. So Dr. Grove, Thomas Grove, so the byline of the book is Regenerate, Don't Operate. Do you have any comments on what that means to you and what your background is in this field?
Yeah, absolutely. So when you're looking at musculoskeletal injuries, there's a couple different ways you can figure out how to get somebody some relief, right? We can mask the pain. Our system is very good at that. We've got a lot of good medications for that. But unfortunately, those sort of treatments, things like steroids, things like nerve blocks, don't necessarily heal tissue. If anything, it can actually damage the tissue. Looking at the studies that are coming out here, even in the last 20 or 30 years. So when you're looking at the body, we'd rather heal that tissue to get you longer-term pain relief. Because if you don't heal the tissue, you're really just putting a Band-Aid on your injury.
True. It's a Band-Aid for a short time because the steroids will last, often not long at all, maybe a day even. And some people get no results. But a lot of people get results for a month or two or three. And I'm one of them. Back in my early days when I played tennis like a madman, I had lateral epicondylitis, which is called tennis elbow in my right elbow. And I didn't know anything. I was a lawyer back then. I didn't know anything about medicine. So I went to an orthopedic surgeon, and of course he gave me a cortisone shot, which is a steroid. Anytime you have ONE, like prednisone, cortisone, that's a steroid. It's a very, very powerful anti-inflammatory. Within minutes, my elbow felt better because lidocaine, which is a local anesthetic, is also put in the mix with the steroid. And then what happened is I went out and played tennis again. Well, guess what happened? The pain came back even worse. I went back to the orthopedic surgeon, had another steroid shot. Guess what happened? Felt great. I then went out and played tennis again, and what happened? It got even worse than it was when I first had this before the cortisone injections. So what did I do? I finally learned about regenerative medicine. I self-injected both my elbows at different times because I've had several injuries. And I don't remember the last time I had any elbow pain now. And I can do anything I like. It's been probably 20 years or more. So, this stuff works. I know that most traditional doctors don't believe in this stuff because, and I always say this, if a doctor is not up on something, he's down on it. All right? And that's what we're dealing with. It's an uphill struggle to educate doctors and patients. And Dr. Grove was alluding to the fact that it's a tough thing for us as providers to educate patients who come in that this stuff works, because everywhere they go, their doctors say it can't work. So we sometimes have to spend an hour with patients explaining the science, showing them things about tissue growth. And sometimes people want to talk to someone else. Well, I'm a good example, but they want to talk to patients. And we have to find patients who have had these things that are willing to talk to these new people.
Excuse me, speaking of patients, we have John calling from Santa Barbara.
John, I love Santa Barbara. This is Dr. Marc Darrow, and we've got Dr. Thomas Grove on the line also. So,
hey, John.
Hi, sir. I really appreciate having this chance to talk to you. So just to summarize what's going on with me, in 2017, I suffered injuries in a car accident and basically went for treatment, and it's only helped temporarily. There was no bones broken, but they're convinced that I have a pinched nerve in my upper back, and then also if I go to a chiropractor for my neck, that helps for like a couple weeks, and then the symptoms come back.
Let me ask you a couple questions, then I'm going to have Dr. Grove ask some questions also and comment. How much damage was there to your car in dollars, if you remember?
The car was totaled.
Okay. So were you rear-ended or something like that?
No, believe it or not, I was in San Bernardino in the desert area, and a car went in front of me, and I slammed right into it.
Okay.
My wife was in the car, too, and she didn't even get injured.
Well, that happened to me in a car accident about 2019. I had my face bashed up, my neck, and I was bleeding, and my nose was crooked, and I thought I was fine, and my wife was screaming, and I said, "Honey, you look fine. Stop it." And she kept screaming.
For sure. I can picture this.
And she kept screaming at me. And I said, "Honey, take some deep breaths. You're okay." And she looked at me and she goes, "You're right, I am, but you're not."
Yeah, I didn't have any broken bones, so you look outwardly and you say, "Oh, okay, he looks okay to me."
Yeah.
Yeah, so the issue with car accidents is they cause something called a whiplash injury, if you guys have ever heard of that term before. But many places that I train, they consider this a total body injury. So just because, there's no bones broken, a lot of times the supportive structures to those bones, the ligaments, can get damaged. So we've got patients that come in every week. Hey, I had a car accident, whether it was last week or it was many years ago. And they've got, neck and back pain. They could have joint pain as a result of these high force traumas. I mean, if you total your car, think about all the forces going through those tissues that try to keep all those structures together. So it's pretty common that we have a lot of ligament damage from an injury like that.
The other thing about that,
science that has improved pinched nerve injuries, because basically everybody's been telling me for quite some time there has been no cure for a pinched nerve, and it's basically something that hasn't been able to be restored.
What is the symptom you're having that makes you consider, or your doctors consider, that it's a pinched nerve?
It's like a throbbing in the back.
That's not a pinched nerve.
Yeah, not a pinched nerve at all.
And to tell you the truth, if it's your thoracic spine, is that what you're talking about, your upper back? Below your neck?
No, it's not the spine. It's right below where the I don't know what it is.
The scapula, the wing bone?
Bone, you could touch that area. It's like in one little spot.
Is it low back, mid back, or upper back?
Upper.
Okay. That is probably exactly what Dr. Grove just said. It's probably a sprain. It can be the costovertebral angle, where the vertebrae attaches to the rib. It can be something to do with the rhomboid muscles attaching to the scapula. And the way Dr. Grove and I find out is, guess how? We touch it. We find out where your pain is. Then we know what to do. We don't make up stories about things are pinched nerves.
Yeah, what's strange is you feel the left side of the back, it feels perfectly normal, and then you feel the right side of the back, and you feel that there's something there.
Okay. Well, I'm going to bet you anything you want that you have a sprain of the rhomboid attachment to your scapula or a costochondritis, which is inflammation between the ribs. And both of those are things that we can heal using platelets and or stem cells. We do it all the time. Yeah.
It's a very common scenario. I literally had a guy with this exact scenario yesterday. People who have car accidents, they have these issues. They get an image and they get really focused on, it must be a pinched nerve. We see something that's not 100% normal on the image. The problem is that doesn't line up with what you see clinically on a physical exam. That pinched nerve isn't really a pinched nerve. A lot of times it's the soft tissue around it. Like Doc was saying, a sprain, people think, you can only sprain your ankle. You can sprain any of these ligaments, right? You got ligaments all over your body. So a sprained back can present the same way.
And what Dr. Grove is saying, to his point, ligaments are just pieces of collagen like tendons. Ligaments attach bones to bones. Tendons attach muscles to bones. Okay? But it's all the same tissue. And if you were ever to open up a physical body, you would see that there is these tissues they're contiguous all over the body. There's fascia, which is also made out of, all these things are made out of collagen. Collagen is the structural protein of the body. It's in everything. It's in our hair. It's ligaments, tendons, joints, cartilage, you name it. And I think there's good hope ahead for you, John. But I think you're going to need somebody like us to be able to actually palpate or touch it, find out where the pain actually is, and then use an ultrasound to look inside to guide where the needle goes to put the solution of platelets and or stem cells right on the spot. Hang with me. I want to give out the phone number again to the studio because this is a great conversation. We don't want to lose you. And the phone number, if you want to call in and talk to Dr. Grove or myself or both of us, is 866-870-5752. That's 866-870-5752. If you want to call the office and get more information there, you get a free consult with my staff. And that number to the office is 800-300-9300. If you want to watch us doing these procedures, you go to the website. It's got videos, tons of videos, at www.jointrehab.com. Anything you want to add to this, Dr. Grove?
And it's a very common scenario that we see. So when you have pain like this and you're not being treated properly, you're not getting relief, this is an amazing, amazing tool that's at your disposal that's minimally invasive. It's a very quick procedure. It's a very safe environment that we use ultrasound for. You're being treated by someone with a lot of training, a lot of experience, so it's something that you shouldn't lose hope for.
How many years have you been involved with regenerative medicine, Dr. Grove?
So I've been doing this for 12 years now. That's the first injection. It was 12 years ago. So a lot of patient encounters, a lot of different injuries. My journey to regenerative medicine came from the professional sports arena. So seeing athletes have injuries, getting treated with regenerative medicine, and keeping them on the field, keeping them on the court, keeping them on the track. And this is where I was really inspired to explore the world of orthopedics. So it's an amazing tool that is luckily not just for professional athletes. We can use these sort of treatments for anybody.
And both Dr. Grove and I have such a similar past, which is we both loved orthopedic surgery, and that could have been. We could have done that. And I did research in orthopedic surgery with the residency program, with the director who guaranteed me a spot. And then I had an orthopedic surgery on my right shoulder. I had a weightlifting injury where my hands were stretched out wide. I was doing bench press, and it sprained my right shoulder. So what did I do? I had a surgery. Why did I have a surgery when I'm talking about all this regenerative medicine? Because I didn't know about it then. That surgery swelled my arm up like a balloon. I had a fever, and it was worse after the surgery for about 4 years than it was when I had the injury. And then I learned about, when I was at UCLA residency, a doctor came in and explained regenerative medicine. I went to his office, and his patients were telling me that he was God, that he could heal anything using regenerative medicine. So I thought, well, I had a wrist injury at the time, and I thought, well, that was from a golfing injury, hitting the ground instead of the ball, and did that on my wrist. It healed up, and then I did one series of injections on my own shoulder, just experimenting. This is back in the experimentation day. And I hit all the spots that were sore, and I woke up the next morning 100% full range of motion, which had been limited, and zero pain. At that point, I was like, this is going to be the work I do for the rest of my life as a doctor. And it's been a heavenly, heavenly profession for me. Dr. Grove and I laugh all day long about all the healings we see. It's just amazing. And then, maybe we shouldn't laugh at what we do about traditional medicine. We go, because we have people that come in with failed surgeries. That's a surgery that didn't go right. And we go, how could these doctors be doing these surgeries? How could these doctors be giving people these medications that are hurting them? How can these doctors be giving people spinal stimulators, morphine pumps, when they don't need it? All these invasive procedures. And again, we always say it's not the surgeon's fault. It's their culture. It's what they grow up in. Dr. Grove and I grew up in it too. But for us, I'm just going to say it this way. We saw the light. We saw the truth in what was going on. And again, I love orthopedic surgeons. Some of my best friends are orthopedic surgeons. But I'm going to tell you this. We're good friends, and we fight like cats and dogs about healing, about what it is. And I did have an orthopedic surgeon who rented an office space for me for many, many years. And he referred me about 15 patients of his a month, most of which healed from using regenerative medicine. And when I said to him, why do you still do surgery instead of these injections? He said, because what you do is placebo. I said, if it is placebo, who knows? If it is placebo, wouldn't you rather do that than cut somebody open and have the possibility of infections and all kinds of problems? And he goes, no, what you do is a lot of bull. Then, this is the best part. He fell off his motorcycle, ripped up his knee, crawled in the office one day, and guess what I did to him? Regenerative medicine. He healed. Did he believe he healed from that? No, because it's a different culture. We all believe our cultures.
I'd like to say one more thing, Doctor. I think
say
a
as
lot
many
of
as you
people like myself... Oh, I'm sorry.
No,
I'd
go
like
for
to
it.
say one more thing. I think a lot of people like myself, Doctor, have struggled because, they're given that diagnosis, oh, no, there's no hope for you, there's no cure, just take pain medicine and go home and just deal with it. So I think a lot of this is because the new technology and the new treatment is so new that people don't realize that it's out there. So I will hang up now, and I will definitely be making a call to your office because basically, like I said, people like myself have been told there is no hope and there is no cure for your injury. So thank you so much.
Don't leave us yet, because you got a lot to say.
Okay.
The phone number to the office is 800-300-9300. You can call there for an appointment or to get more information, get a free consult from our staff. But I want to just mention this. Regenerative medicine has been around since the beginning of time. It is not something new.
It's a very old treatment, yeah.
It's been in every culture. It was very crude way back when. We know stories in China using needles that were heated up to burn the tissue and create collagen that way. We know about Hippocrates, the father of Western medicine, 500 BC, who used scalding rods of metal for the javelin throwers in the Olympics because they would have dislocated shoulders. And he would scald the armpit, the axilla, and create collagen, their tough collagen that would keep the shoulder in the joint, in the glenoid joint. So it sounds like it's something new, but it isn't. And the injection techniques have been around since around 1900. And in Chicago in the 30s, there were a couple docs there, Hemwall and Hackett, who did this prolifically. They did it, and they were very famous. And then this spread a little bit, and then it kind of fell away as they got older. They didn't have any disciples then. And in the 80s, it started becoming more prevalent in the 1980s. And now it's, you can find doctors on every block who are doing regenerative medicine. It's just that most of them are not trained well, and they don't know what they're doing, or they don't use ultrasounds, and never go to, you don't go to a chiropractor to get regenerative medicine. They'll hire off, and this is not against chiropractors. I love chiropractors. And I want to give out a pitch to my favorite chiropractor, who is Dr. Randy Weinzoff in Santa Monica. He's the guy I go to if I have a sprained neck, and he can pop it back in. But he's a great guy too. And we refer to each other. When he has a dead-end patient, he'll send him for regenerative medicine. And when I have people with what's called real radiculopathies, real pinched nerves, he can often straighten out the spine and get rid of those in sometimes one treatment, sometimes just a few. So, we all got to wake up to everything in life. I mean, everybody, I think, is looking for the truth in whatever field they're in. And the truth of medicine, to me, is be conservative. Don't be invasive. You can always get invasive down the road, but be conservative in the beginning. See what you can do that can heal the body naturally. And I always tell patients, the best thing you can do is stay away from doctors.
Okay, thank you, sir. I really appreciate this, and I'll be making a call to your office soon.
All right, John, God bless you. We love you.
John, look forward to seeing you.
Sir. Okay, sounds good, sir. You guys have a wonderful day.
All right, so I'm going to give out the phone number to the studio. We have a few more minutes to this session. And if you want to talk to Dr. Grove and I live, give us a call at 866-870-5752. That's 866-870-5752. If you want to talk to my staff or you want to make an appointment, call the office at 800-300-9300. If you want to watch videos of us doing these procedures, go to the website, www.jointrehab.com, and you can also send us emails. You can send Dr. Grove and I emails through any page on the website. There's a spot to email us. Unfortunately, the show is done. Thank you, Nita Valens. Thank you, Dr. Grove, Suzette, Alex. And again, if you want to call the office, the phone number is 800-300-9300. God bless you all. We love you so much.
Thank you, Dr. Darrow. Thank you, Dr. Grove. See you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his Joint Rehab and Sports Medical Center experts for free, and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.